This podcast is meant to provide information on reproductive health. It does not establish a physician-patient relationship, and we would urge you to contact your treating provider regarding your care.
Hi, I'm Dorette Noorhasan, a fertility specialist, and I'm here to talk to you about all things reproductive health. Before we get into IVF, fertility treatments, surrogacy, let's just start with the basics. We're going to talk about natural conception today and understanding the menstrual cycle. So if you're out there and you want to understand the menstrual cycle and how to conceive, or if you're a partner and you want to help your partner out understanding the menstrual cycle and when to pinpoint when to conceive during the menstrual cycle, we're going to talk about that today. I like to think about the menstrual cycle as two phases, follicular phase and luteal phase. And in the middle of that, the transition is ovulation. Now, I know out there are certain diagrams that have four phases where the first 5 days or the first few days of the follicular phase where you have bleeding, they call that the menstrual phase, but that's also part of the follicular phase. And then it's not as choppy as where you think it's just a phase and a phase and a phase. It actually is a continuum where it transitions slowly, where sometimes you're kind of at the end of one, but not into the next phase. So I don't want to think about it as choppiness in terms of phases. So let's talk about the menstrual cycle. If you have 28-day cycles, in theory, you ovulate on cycle day 14 because the second phase, the luteal phase, is 14 days long. If you have 30-day cycles, you ovulate on day 16 because, again, that luteal phase is fixed at 14 days, which means the first phase, the follicular phase in this person is about 16 days long, not 14 days long. If you have 35-day cycles, you ovulate in theory on day 21 because, again, the luteal phase is fixed at 14 days. So that follicular phase in this person is 21 days. Now, you could buy ovulation predictor kits over the counter, and those can help you with tracking your ovulation. You could also use apps that will tell you the pattern of your menstrual cycle and help you predict ovulation as well. Now, let's look at someone with perfect 28-day cycles. Remember I said, in theory, this person has or ovulates on cycle day 14. Well, what I will tell this person to do is to start having intercourse once a day for 3 days, leading with the last day on the day of ovulation. So this person would have intercourse on day 12, day 13, and day 14. And you would have hit the 3 most important days, the 2 days prior to ovulation and ending on the day of ovulation. If you were a little bit unsure as to the cycle, because you have perfect 28-day cycles, but sometimes it's 27 and sometimes it's 29-day cycles. And so you may want to expand that range. And so what I would say for that person, I would have intercourse every other day between days 10 and day 20 of the cycle, with once a day on days 12, 13, and 14, 2 days prior, and the third day on the day of ovulation. And then you would have expanded the window to potentially conceive during that cycle. Now, it's not an emergency. I know sometimes you get your ovulation predictor kits and you're calling your partner, you're like, you need to be home right now. We got to have intercourse because we need to get pregnant. It's not as urgent as that one moment. You do have a window, and that's why I'm telling you how to expand that window when to get pregnant. As well as it's been shown that sperm can live in the female reproductive tract for up to 5 days. So even if you had intercourse today but ovulated tomorrow, there's still a chance you could get pregnant with this cycle. You may want to start using the ovulation predictor kit starting around day 10. So I would start checking my urine on day 10 of my cycle to see if I'm getting the LH surge. Now, the LH surge is the ovulation hormone. In the predictor kits, sometimes that show up as a second blue ribbon or a second blue band on the predictor kit. Sometimes it shows up as an egg drop or as a smiley face, tells you when you're ovulating. So I would start utilizing the ovulation predictor kit around cycle day 10, and then you'll see which days you ovulate and when to have intercourse. I'm often asked, what about my health? Do I need to get healthy for pregnancy? When we're younger, our eggs and sperm are healthier. As we advance in age, our eggs and sperm deteriorate in their function. Just like you and I, today, as we advance in age, we see it on the outside. Our skin sags, our energy levels not the same as when we were in our 20s. The same thing is happening on a cellular level. So within our cells, their ability to function declines with time and age. So now we have to change our lifestyle so that we improve our cell function. And so changing your lifestyle means cutting out processed foods, eating a healthy diet. I will tell you there's no one perfect diet, but I would say staying away from processed foods. The Mediterranean diet seems like a decent diet, but again, there's no one special diet that you have to follow. I would also say cutting out substance usage like excessive caffeine, excessive alcohol, marijuana, edibles, smoking tobacco. Those types of things will deteriorate the egg and sperm function and therefore deteriorating our chances of conceiving. Also, getting a good amount of sleep. You want to get about 7 to 9 hours of restful sleep. You know, when you wake up in the morning and you've had a good restful sleep the night before, your energy level is great. You feel like you can tackle the world, do your job that day. The same thing is happening on your cell, on a cellular level. Your cells, the ability of those cells to function requires those cells to rest. And so when they're ready to function, they function efficiently, not working slowly or because they're tired. The egg cell is the most or the egg cell actually is the biggest cell in the human body. And so within that egg cell, within the cytoplasm, there are organelles or machinery within that egg that drives the production of producing another person, a baby. The sperm is also important, believe it or not. The sperm contributes to the embryo. And so if you have sperm, you also want to have a good, healthy lifestyle because, again, the healthier you are, the better the sperm you're going to produce and the higher chances of having a healthy pregnancy.
Pioneer.